Tonight, Tasmania records its first death from coronavirus. Also tonight, three's a crime. New distancing rules limit crowds to 2. The PM promises $130 billion for wages to get through the shutdown. And the new rapid test kits for COVID-19. Good evening, Guy Stayner with ABC News. It's the reality check nobody wanted. A woman has died of coronavirus in Tasmania, the state's first virus-related fatality. The death comes as Tasmania and the rest of the nation grapple with new restrictions on going out in public, restrictions that will be enforced by police and the army. The new rule limiting public gatherings to no more than 2 people comes in at midnight tonight. The exceptions are if you live in the same household, if you can't work from home, need to go out to buy food or essentials, or to see a doctor. And the government wants those over 70 to stay at home. 18 people have died from the virus in Australia. 17 of them were over 70, and the other was a man in his 60s. In terms of economic health, the government has just unveiled a $130 billion package, including a wage subsidy. Businesses will be paid up to $1,500 a fortnight for each employee. Anna Fromberg begins our coverage.
It was the update Tasmanians had feared.
I can confirm that a woman in her 80s this morning passed away in the North West Regional Hospital. This woman was being treated for COVID-19.
The woman had been unwell in hospital for several days. It's unclear if she was a cruise ship passenger. Her death has been referred to the coroner.
It really brings it home, doesn't it, that it is a serious thing that we're not immune to. So I'm really sad for the family.
Unfortunately, this won't be the last death.
To help stop the spread, police will enforce the ban on social gatherings of more than 2 people from midnight tonight. Playgrounds, skate parks and some popular beaches have closed as a result.
And as of midnight tonight, an order will come into effect to enforce those rules. This means that unless you are going to work or school, getting essential or medical supplies, exercising or providing compassionate care, you will need to remain in your primary place of residence. And you will be committing an offence if you don't.
Shacks are also off limits unless they're your primary residence, but recreational boating is still permitted as long as the 2-person rule is applied.
For those that love their shacks, you won't be able to go to your shack for school holidays or for Easter.
There's confusion about what the new rules mean for businesses. Labor says it's been inundated with calls from retailers wanting to be shut down.
The clear message should be they can, if they're worried about their safety or the health and well-being of their staff or customers, they can close and they will not be restricted from accessing government support if they do that.
There still are conflicting messages and people are certainly confused.
4 new cases of COVID-19 were announced overnight, bringing the state's total to 66. All 4 are cruise ship passengers who had been self-isolating. Public Health continues to investigate 2 possible cases of community transmission in the Devonport region after a health worker was infected at the Mersey Hospital.
Neither case had travelled overseas or been on a cruise ship in the past 2 weeks before their illnesses. Public Health Services has established a public health response team to investigate the 2 cases.
We will also be doing enhanced surveillance for coronavirus infection in the Devonport area through increased testing of people with fever or respiratory symptoms.
About 50 members of Australia's Defence Forces have begun arriving in Tasmania to help enforce containment measures. They'll be working with biosecurity officers and police to carry out compliance checks, including spot checks on people in self-isolation at home.
As from tomorrow, this will be a new Tasmania. It will be a different Tasmania.
The new rules will be in place for at least the next 4 weeks. On-the-spot fines of between $750 and $1,000 are being considered. Anna Fromberg, ABC News.
Police have spoken about how they're going to enforce the new restrictions in Tasmania. Edith Bevan was at this afternoon's media conference. Edith, how hard are police going to go?
Well, I mean, it's a huge task. Since Wednesday last week, they've already carried out more than 1,300 compliance checks on people who are supposed to be self-isolating across the state. So far, they've discovered 40 breaches or suspected breaches and fined a further 10 people for flouting the directives and camping on the East Coast. So that was before the latest directives from the state government, which are essentially that Tasmanians are only allowed to leave their homes now to go to work, to go shopping for the essentials, for healthcare reasons, or to exercise. So it's a huge task they've got ahead. And as you said, we spoke to the Deputy Commissioner, Jonathan Higgins, this afternoon about how on earth police are going to actually enforce those latest directives.
We will do random checks as well. It may be pulling cars over during our normal targeted duties for our random breath tests and random drug tests. It may be a way that we do it. We won't be doing static checks pulling over all cars.
Edith, it clearly is a massive undertaking. So how are they going to police so many people in so many places?
Well, we've already heard from the Commissioner that police from other areas have been called off those areas to help with those frontline checks. We also have been told that police are allowed to let some of the more minor duties go while they focus on the coronavirus. Remember, as Anna Fromberg has already pointed out, we've got 50 Australian Defence Force personnel who have already begun to arrive in Tasmania to help with those checks. On top of that, members of the SES and the Tasmanian Fire Service are helping out in carrying out those spot checks. But it is a huge task, and while police have only fined 10 people so far, there is a reminder tonight that if you are caught breaching any of those directives, you are facing a fine of almost $17,000 and 6 months in jail.
Edith Bevan, thank you. History is being written every day in this crisis, and a big piece of economic history has just been made. Scott Morrison is forging into uncharted territory, launching a record package to try to preserve the jobs of up to 6 million workers. It's by far the biggest single spending program ever committed, and it'll be spent in just 6 months. Here's political editor Andrew Probyn.
Australia's seen nothing like it.
Now is the time to dig deep. Governments making decisions like they never have before.
An astonishing third economic rescue package, upping the defences against a crisis that confounds like no other before.
We are committing $130 billion over the next 6 months to support the jobs and livelihoods of what we anticipate of being almost 6 million Australians.
That's $5 billion a week to be spent tackling a jobs killer, one that's already seen hundreds of thousands of Australians join Centrelink queues. The $1,500 a fortnight JobKeeper allowance will be payable to full-time, part-time and casuals who've been on the books for more than a year. That's up to 6 million Australians, or nearly half the working population. Small and medium-sized businesses who've lost more than 30% of turnover will be eligible. For businesses with turnovers of $1 billion or more, they'll be eligible if their turnover has dropped by 50% or more. It's backdated to the 1st of March, meaning many of those made redundant in the past few weeks might get the payment.
So if you're an employer who's been forced as a result of the downturn following the coronavirus to retrench workers, you'll put them back on your books and you'll receive this $1,500 payment.
Employees won't be going to Centrelink. They won't be engaging with the social security system. They'll be engaging directly with their employer, and their employer will be making the payments.
For this struggling golf club in Brisbane, it hits the spot.
Oh, that would help us big time because we'd be enabled to keep our full-time staff.
The club's lost 80% of business and had to lay off 3 full-time workers and all the casuals.
And I'm on edge if I'll have an income and places to go afterwards, but that should keep everyone rolling and happy.
In throwing a gobsmacking amount of money at the coronavirus crisis, the government's so-called hibernation strategy is taking shape. At enormous cost, it wants the Australian workforce to spring back to life as soon as the virus threat lifts, whenever that is. The stakes couldn't be higher. The Prime Minister grimly predicts this crisis will bankrupt some nations and cause others to collapse altogether. He's determined to make sure Australia isn't one of them. Andrew Probyn, ABC News, Canberra.
And National Affairs correspondent Greg Jennett joins us from Parliament House. Greg, no one's ever seen spending on a scale and speed like this before. How do we know it will do what it's meant to?
Well, that's just the thing, Guy. We really don't. So there are some solid designs here, it must be said, that actually put the obligation on employers to keep workers on their books. But no one could guarantee that most people who had a job before the 1st of March will have that job back again in September. And that's just the nature of the times we're living in, I guess. But here's what this package does tell us. No government has ever committed $130 billion to any one-off 6-month program since Federation. It's worth more than a fifth of an entire normal budget spending for an entire normal year. So its enormity only confirms the gravity of the situation here, Guy. And there is a reason why Scott Morrison, his words, would be hoping and praying that no government ever has to launch this sort of rescue again, because on these sorts of numbers, it's hard to imagine a repeat dose could ever be afforded, which is exactly, Guy, why it kind of needs to work too.
Everyone will now be able to access a GP or many other kinds of health experts by phone or video. It's called telehealth, and it's designed to keep patients out of clinics and preserve supplies of protective equipment. Medical reporter Sophie Scott explains.
A bit of a cough, which is a bit concerning for me.
In a major shake-up to healthcare, patients can now video call or phone their doctors for a consultation.
This will make a huge difference. You've got all your medications.
The virtual visits will be bulk billed, eliminating any out-of-pocket costs.
How popular do you think telehealth will be with Australian patients?
I'm expecting that 80 or 90% of my consultations will be by telehealth.
The move means waiting rooms will be a lot less crowded, which experts hope will slow the spread of the virus.
2.8 million Australians visit their GP every week. We can't have a situation where the majority of the country puts their primary care on hold.
So we're learning, and so are our patients who haven't ever had to do that before.
As well as GPs, patients can have telehealth consultations with psychologists and psychiatrists, nurses and midwives, paediatricians and other experts for kids with developmental delays. Measures are also in place for Aboriginal and Torres Strait Islander health assessments, people with eating disorders and people in aged care. The move away from face-to-face consultations will protect patients and staff and save precious supplies of masks.
There are obviously cases in various parts of the country where that supply is wafer thin and very much at an extremely short supply level.
If telehealth isn't for you, that's okay. Clinics will still be open for face-to-face consultations for medical problems that can't be treated over the phone.
So it's day 4.
The changes mean those who need to stay home can and still get the medical care they need. Sophie Scott, ABC News.
Just how many people have had the virus or carry it with no symptoms is still an unknown. But soon, rapid test kits will be available across the country. They'll return results in minutes and show whether the patient has coronavirus antibodies.
Testing for COVID-19 could be as simple as this: a prick to the finger. It is a common way of assessing diabetics, and a similar type of test will soon be available to check for coronavirus antibodies, proof someone has had the disease. Australian biotechnology company CellMid expects its first shipment of rapid testing kits from China to arrive next month.
The way it works is that there are 2 little receptacles here, and you basically put blood in one and you put the reagent that you get with the kit with the other, and you put it down on a table, and it develops over a period of anywhere between 3 to 15 minutes.
The University of Technology Sydney is also working on an improved version of the current test. It would ideally give a result in less than an hour and would cost about $10.
What we are trying to shrink all these multi-stage scenarios to a single home-based type test similar to the pregnancy test.
He says the different types of tests won't compete against each other and that testing should eventually be expanded to more Australians.
The more information, as I said, get generated, the more tests get done, the better position we are in for the future development or even recurrence of this disease.
The Deputy Chief Medical Officer, Paul Kelly, says rapid testing is not the gold standard.
In the acute setting where someone is sick with this virus, actually those tests have a very limited capability to test whether people do indeed have the virus or not.
But for those wanting a test, options are on the way. Kathleen Ferguson, ABC News, Sydney.
There are encouraging signs that Australia's strategy to slow down the growth in new coronavirus cases may be having an impact. Here's Casey Briggs with a look at whether we might be flattening the curve.
There are now more than 4,200 confirmed coronavirus cases in Australia. 1,918 of them, almost half, are in New South Wales. It's been a relatively slow day of growth in cases. New South Wales today recorded its smallest daily jump since last Sunday. South Australia, only 6 new cases today, its smallest rise in more than a week and a half. That could be a very good sign. It could show that social distancing measures are starting to work. But there are lots of caveats. The number of cases that you find partly depends on the amount of testing you do. Is there local community transmission going on that we just don't know about? We also today learned of 2 new deaths, the first for the ACT and the first for Tasmania, bringing the total across Australia to 18. Globally, more than 720,000 cases of coronavirus have been confirmed. A fifth of those, 143,000, are in the US. And just one country to keep an eye on as the days progress is Turkey. Less than 10,000 cases at the moment, but they've got there faster than any other country. The trajectory of that country's outbreak is the steepest in the world.
Still to come on ABC News, Britain goes on an emergency footing. And no whining, savvy tasters tipple online. Five men have been charged with murder in Tasmania's northwest. Police were called to a house in Burnie around 3 o'clock Sunday morning. A 23-year-old man had been severely injured in an altercation. He died later in the Northwest Regional Hospital. 5 men from Burnie appeared in court this afternoon. They've been remanded in custody. The Australian Antarctic Division has found a new ship to resupply its stations in Antarctica and on Macquarie Island next summer. The MPV Everest has space for up to 100 expeditioners and 96 cargo containers. It's a temporary measure necessary because of the end of the Aurora Australis' contract and the delayed arrival of Australia's new icebreaker. The new ship was due to arrive in Hobart at the end of the year, but coronavirus will delay its arrival. Well, as the Premier said, it's a new Tasmania from tomorrow. Reporter Alan Coulter takes a closer look at what all the new restrictions mean.
Under the tough new measures, it will be an offence to leave your home unless you're going to work or school, or you're exercising or providing compassionate care, or getting essential supplies. So, what is an essential supply? Groceries, takeaway food, takeaway coffee, medicine and anything you can get from a shop or service still legally operating is okay. That means you could purchase supplies that will help your family through isolation, such as games and puzzles or hardware items. The advice is to limit those shopping trips as much as possible. The crackdown on people leaving their homes has raised questions about who Tasmanians can visit. You can leave your home to provide social support or care to another person, for example, checking on a neighbour or relative. The government says visits to family members or partners who live at other premises are allowed. The restrictions on gatherings do not apply to deliveries, renovations, repairs and removals. And what about separated families and families who are split across 2 homes? Tasmanians are allowed to leave home to facilitate shared custody, guardianship or care arrangements, so children who live between 2 homes will be able to spend time at both. Grandparents are allowed to see grandchildren, but elderly people are advised to keep away from unwell children. You're still allowed to exercise, but there are restrictions depending on where you are and who you're with. Families who live together are allowed to exercise together. Otherwise, the two-person rule applies, so you can exercise with one other person while keeping 1.5 metres apart. The Premier says people won't be able to go to their shacks for holidays or for Easter. So, what are the rules? Tasmanians will be allowed at their shacks only if they're already self-isolating there or they plan to reside there for the next 4 weeks. The Premier doesn't want any movement between primary and secondary residences, and police will be carrying out random checks on where people are travelling.
For the first time since the Second World War, Britain is now on an emergency footing. Prime Minister Boris Johnson is trying to prevent it getting as bad as Italy, where nearly 11,000 people have died. Europe correspondent Samantha Hawley reports.
Italian police salute a convoy of army vehicles transporting bodies. Another day, another 756 people die. The grim toll is now nearing 11,000. In Naples, a priest leads mass from the roof of a church. The neighbourhood congregation gathers on balconies to pray.
In Cristo Gesù nostro Signore. Amen.
Police deploy their eye in the sky to check on people disobeying the lockdown. And on the ground, the police are also deploying water cannons, normally used to disperse protesters, but now to sanitise the streets. 250,000 face masks are flown into Venice, where the health system is collapsing under the strain. So many doctors and nurses have been infected, the government is appealing to healthcare workers to travel to the north and help. More than 50 doctors have died, and at least 4,000 nurses have the virus.
The north is still in a deep crisis. We have a shortage of specialized people in the health sector because they have been contaminated.
15% of Spain's medical professionals are ill with COVID-19. The country's just recorded a new daily record of 838 deaths, taking the death toll there to over 6,500. Britain is now on an emergency footing, with special coordination centres being set up across the country and the military being deployed. Boris Johnson has warned things will get worse before they get better, and it could be up to 6 months before things start to return to normal. Samantha Hawley, ABC News, London.
About 400 Australians stuck in India have called on the federal government to get them home amid growing fears for their safety. A tough nationwide lockdown has been declared and police are brutally enforcing it. James Oaten reports from New Delhi.
Casper Simonson's near-empty hotel has been his refuge for a week.
So essentially, from what you can see there to this gate here, that's sort of as much free rein as we get.
The streets outside the hotel's gates in the South Indian city of Pondicherry are empty. Grocery stores and pharmacies are meant to stay open, but the Queenslander is afraid to go out.
The lockdown is enforced very, very heavily by the police here, so there's been many reports of people getting caned and beaten with batons for breaking lockdown procedures.
Videos of overzealous police striking and degrading alleged lockdown breakers have featured heavily in local media. So too has Vision showing thousands of migrant workers massing near transport terminals and state borders, desperate to get to their hometowns and villages.
This is the view from our hotel room.
Australians stuck in hotel rooms have noticed a shift in community anxiety.
And it changes rapidly. Which is a scary part.
We will be seen as disease and virus spreaders.
Morning, my name is Navin.
Navin Chitator arrived in Chennai to visit his family more than 2 weeks ago. Just a few days ago, something changed.
Quarantine label on my house.
Now his family's struggling to get food delivered.
Milk is the main thing, it's been cut off. And since my brother's wife, she's pregnant, 6 months pregnant, and she needs to take her nutrition every day.
The Prime Minister Narendra Modi has apologised for the hardship this 3-week lockdown has caused, particularly for the nation's poor. But he's doubled down on the aggressive measures, saying they're necessary to win the war against coronavirus. James Oaten, ABC News, New Delhi.
The big fiscal support package announced this afternoon lifted the local share market to its biggest rise this year. Here's Alan Kohler.
In fact, it was the biggest one-day rise in years, 6.6%, turbocharged in the last half an hour after the $130 billion stimulus package, number 3, was announced. It was led by the banks, with Commonwealth jumping a remarkable 11% and Westpac 8.5%. A couple of other notable rises. Ansell, which reported that surgical gloves and other protective gear are selling like hot cakes, and the market went, oh yeah, rubber gloves, and bid the stock up 25%. Also, Regional Express jumped after the rescue package for regional airlines that was announced on the weekend. Now, there weren't many falls today, but investors are still worried about shopping centres like Scentre Group. And here's why. Foot traffic has collapsed, and that's before the government started imposing lockdowns. In general, there have been 158 guidance updates from ASX 200 companies this month, of which 122 or 77% simply withdrew the previous guidance because they're flying blind now. Today's rise here came despite falls everywhere else in the world, including around 3% in New York and Tokyo. And by the way, an interesting problem has come up in the United States share market. Zoom has become a popular platform for business meetings and socialising, so naturally their shares have become popular too. But confusingly, there are 2 companies called Zoom, and the other one is a defunct company based in China and makes no money. But a lot of people have been buying the wrong one by mistake. The oil price fell again, so did iron ore and copper, and the Australian dollar stayed roughly steady at around 61.5 US cents. And that's finance.
The AFL has secured a line of credit from both the NAB and ANZ as it navigates the COVID-19 crisis. The ABC understands it's secured loans of more than $500 million to try to save all 18 clubs from financial ruin. Despite the cash lifeline, AFL boss Gillon McLachlan warned the code is still facing losses of hundreds of millions of dollars this year. The league suspended its season after round 1, and there's no guarantee of when it will resume. Like so many of life's pleasures, wine tasting tours are off limits due to coronavirus. But one Barossa Valley winery has found an innovative way to make sure eager customers don't miss out. It's set up virtual tastings, delivering to homes so tipplers can stay connected.
Speaking of that, I've got an empty glass, so I'm just going to have a top up right now.
Organise time and a place with a few of us and, get together apart, sit down, nothing too technical, but get a bit of community back.
The online service is timely. All South Australian wineries will be forced to close their doors tonight due to a local outbreak of COVID-19. To the weather, and tonight's photo of a gorgeous purple sunrise over Home Point, Launceston, is from Ben O'Loughlin. We had a bit of a change today that kept temperatures a touch below average, 19 in Burnie and Devonport, 20 for Launceston. Hobart topped and tailed the state's extreme temperatures with the low of 5 at Mount Wellington and a high of 21 at Hobart Airport. There were some decent falls around the northwest yesterday. 38 mils fell at Erebor, 27 at Wynyard, 17 at Smithton, 18 at Devonport and 14 in Launceston, just 2 mils in Hobart. The satellite image shows the front passing over us today that shifted the northerly winds to westerlies. The front on the next chart, here it is, should slide south of Tasmania on Wednesday. Across the country tomorrow, rain in Brisbane, windy in Canberra and pretty nice in the other capitals. Back home, there'll be showers about the west and far south, but mainly fine everywhere else. 19 for Strahan, Burnie and Devonport, 20 for Launceston and Hobart, 21 in Swansea. Sunrise tomorrow will be at 25 past 7. On coastal waters, there'll be southwest to northwesterly winds of 10 to 20 knots, reaching 25 knots about the southwest. There are no warnings. Wednesday, there'll be light showers about the northwest and far south and fine elsewhere, 21 in Hobart and 22 in Launceston. And on Thursday, it will be wet. There'll be showers about the northeast, increasing to rain and extending across the east and southeast during the afternoon. We're looking at 15 to 25 mils for Hobart and 10 to 20 mils for Launceston. And that's it for this evening's program. Don't forget you can watch the Premier's daily coronavirus briefing live at 9:15 tomorrow morning by going to the ABC Radio Hobart Facebook page, or you can listen to it on Mornings with Leon Compton on ABC Local Radio right across Tasmania. See you tomorrow.